Hello, I'm Dr. Paul Wang, Editor-in-Chief, Circulation, Arrhythmia, and Electrophysiology. I'm delighted today to interview Vicki Fangel at the Center for General Practice at Aalborg University to discuss her interesting paper, Glycemic Control and Thromboembolic Risk in Patients with Atrial Fibrillation and Type 2 Diabetes, a Danish cohort study. Mia, welcome.
Thank you very much, Paul Wang.
Great. I wonder if you could start by telling us about the purpose of your study.
Sure. Well, currently it is generally recognized that diabetes mellitus is associated with an increased risk of thromboembolism among patients with atrial fibrillation. However, less is known about the potential underlying mechanisms that may explain this increased risk. And therefore, we sought to determine whether glycemic status evaluated by the hemoglobin A1C had an effect on the risk of thromboembolism among patients with atrial fibrillation and type 2 diabetes.
Great. That was fantastic. Great. If you could tell us a little bit about maybe what the major findings of your paper are.
Sure. Well, in this cohort study, we identified 5,386 patients with incident atrial fibrillation and type 2 diabetes through Danish registries. Based on the most recent hemoglobin A1C, we divided patients into groups of tight, moderate, and poor glycemic status. When comparing patients with a hemoglobin A1C of 48 millimolar per molar or less to patients with a hemoglobin A1C of 49 to 58 millimolar per molar, we observed a statistically significant higher risk of thromboembolism with a hazard ratio of 1.49. Similarly, hemoglobin A1C of 58 millimolars per molar or more was associated with a hazard ratio of 1.59. So overall, we found that both moderate and poor glycemic status was associated with an increased risk of thromboembolism in patients with atrial fibrillation. However, we also stratified patients according to their diabetes duration, and quite surprisingly, we found that among patients with a diabetes duration of more than 10 years, there was no association between an increased hemoglobin A1C level and the risk of thromboembolism.
That's really fascinating. I wondered, would you be able to comment for our audience anything that you could suggest that clinicians and other research could translate your work in their practice or research?
Yes, well, our findings indicate that among patients with a shorter duration of diabetes, there is a higher risk of thromboembolism associated with poor glycemic status. This may indicate that patients with poor glycemic status should be monitored more closely in everyday clinical practice. Moreover, it may indicate that these patients should be considered for oral anticoagulant therapy due to their higher risk. However, as our study is purely observational, we cannot translate these results into a potential beneficial effect of lowering blood glucose levels among patients with atrial fibrillation. So if we want to know whether or not it would be beneficial to aim for lower levels of blood glucose in these patients, we will need randomized controlled trials looking into specific strategies to lowering the blood glucose levels.
Great. Well, thank you, Mia, for being with us today and describing your interesting study. This has been Dr. Paul Wang, Editor-in-Chief of Circulation, Arrhythmia, Electrophysiology with Vicki Fangel at the Center for General Practice at Aalborg University to discuss her paper about glycemic control and thromboembolic risk in patients with atrial fibrillation and diabetes. Thank you.